I want you to consider for a minute how we would measure these three research questions. Do children who are bullied suffer depression as adults? Do doctors discriminate against women in treating heart disease? Does texting while driving increase the risk of having an accident? Is using a randomized comparative experiment okay? Well, consider in a randomized comparative experiment, you have to impose a particular treatment in order to determine if there's a cause and effect relationship. It would be unethical to intentionally impose bullying on children to see if they're going to have depression later on as an adult. It would be unethical to tell doctors to intentionally discriminate against women for treating their heart disease. It would be unethical to tell people that they need to text while driving to see if they have more accidents. So sometimes it's not ethical to do an experiment because the treatment that you would be imposing is not a risk that you should ask somebody to do. Now, there are certainly children who are bullied, there are certainly doctors who do discriminate, and there's certainly people who text while driving. So we could still do a study on this, we just would have to do an observational study. Because here, people would self-select to be in these particular groups. Well, they may not want to be in these groups, but some people would already be in these groups, and so you're not imposing anything that isn't already happening. So keep in mind that an observational study can be good as long as you are comparing. So what you can do is you can do what's called matching, and that's going to control for lurking variables. So you may take two children with similar backgrounds, one who was bullied and one who was not, to see what kind of differences that you had. You may take two similar drivers, one who texts, one who doesn't, to see if the texting person has more accidents. Now, you would want to do lots of matching, but you could certainly come up with a way to make a comparative study, even if it's not an experiment. In a recent study in the United Kingdom, they examined data on 3,898 patients in a large observational study. They had information on both victimization by peers at age 13 and the presence of depression at age 18. So they did not impose this victimization, but they had information about it. So the researchers were able to look at lots of different variables, not just this idea of whether or not bullying was the problem, and they had more than just this response variable of depression. But I want you to look at the conclusion that the article stated. Compared with children who were not victimized, those who were frequently victimized by peers had over a twofold increase in the odds of depression. This association was slightly reduced when adjusting for confounders. So take a note of that comment, adjusting for confounders. All that means is that they were able to isolate the differences between the two groups, and that they were able to adjust for this so that a good comparison could be made. The last thing that I want us to look at is this idea of statistical significance. When you read a study, you will often see the words statistically significant or statistically insignificant. All that means is that sometimes any observed differences could have happened just by chance. If you were to have two results that were relatively close to each other, it would be hard to say confidently that it was actually the treatment that made those differences. But if the differences are quite far apart, then you are confident that it was actually the treatment that was doing the effect. So statistically significant is obtained by a few research methods that we're not going to talk about here, we'll talk about later on in this class. And if you have a study where the effect is large enough that it would rarely occur by chance, we're going to call that statistically significant. So there's a lot of probability, and there's some research methods that go into making that decision how likely these differences could occur by chance. But for right now, recognize that the word statistically significant means that having these differences are so rare to have happened just by chance that we have to consider that it really was the treatment that was affecting the outcome.